What up, fellas? It's Ty. Welcome back to the channel where we discuss all things prostate and prostate cancer related. If you're new here, welcome to you. If you've been here, watched the video, maybe even liked and subscribed, I appreciate you and welcome back. So, full disclosure, today's conversation is going to be a bit rudimentary for some of you. Right? Some of you have already done this research, already know this stuff, already been through it. So one of the things that I want to let you all know is that if you're in a bad mood, if you're not in a place to get this, go ahead and push pause, stop the video, and then just come back later on. I want you to get this information, but I don't want you to get it in a place that you are not ready to accept it. Okay? So here we go. Once you're diagnosed with prostate cancer, you have some decisions to make. Right? Now, ultimately, as I go through this video, I want to be very clear that whatever medical decision that you and your doctor come up with as far as what your final care is going to be, it's going to be between you and them. All I'm trying to do is what I did, is that I wanted to be actively involved in that conversation. I did not want to go in there and have that doctor tell me what it is that I needed to do or what the decision was that I should make without asking some questions and then deciding for myself what I was willing to live with and what it is that I wanted to happen. Okay? So this is how I actively get involved. All right? So if you've done some research, or maybe you haven't had time to do so, there are at least 3 things that I found that you have the ability to do once you've been diagnosed with prostate cancer. You have the radical prostatectomy, where they remove your prostate from your body. They go in. For me, they went in through my stomach. And they actually pulled out the prostate, and so that process, and then you have your recovery, and then you have radiation. Radiation is when they actually go in and pinpoint where the cancer is and send radiation in. I don't know if it kills it. I'm not really sure what radiation does. I know that it goes in. I don't know if it stops it from growing or whatever, but it goes in and actually they send the radiation in there. And then there's active monitoring. Active monitoring normally happens when your prostate cancer is early. So if you have like 3+3, then that actually is when they normally tell you active monitoring, and that's really what it is. You continue to go back and forth to the doctor. They check what your PSA is until such time as they feel there's some need to move forward, or you decide you want to move forward. So here's what it is. When I go to the doctor and I'm having the discussions about that, or when I had the discussion about that, I follow what I call the if-then method. When I'm talking to my doctor, whatever it is that they are suggesting to me, I say, if we do that, then what? Well, what do you mean, then what? What happens after that? What's the next step? Like I asked because I didn't want to do anything at all. Then I'd read about the erectile dysfunction, and I'm not an old guy, but I'm not a young guy. But I was like, hey, what are we doing with that, right? And so I asked the doctor about radiation. I said, what happens if I don't do radiation? If I do radiation. It's like, oh, well, if you do radiation, there's a chance that you won't have erectile dysfunction. So, and once you do that, and I said, oh, is there any time that I would have erectile dysfunction? Oh, well, later on and down the road, you probably could have some erectile dysfunction. Well, then what happens after that? So can I then have the prostate cancer surgery? By the time I went through that road, I was like, there's no way in hell I'm getting radiation. All right. And I encourage all of you to go read about radiation because it may work for you. It wasn't going to work for me. I didn't have any idea outside of what they told me initially. I had no idea. Again, for me, and these are all my things, right? I went in there and I said, again, I didn't want to do anything, but I said, hold on one second. I said, let me find out what happens with active monitoring, right? I was 3 + 4 = 7. It's in the middle, but it wasn't, it was like, I don't know. So I said, let me decide what I'm going to do with my 3 + 4 = 7. Can I actually do the active monitoring? So what is active monitoring? Well, active monitoring is when you come in and we check, okay, and then how often do you check it? And then how do we know when to go forward? That was the question that I didn't really get a good answer from. How do I know when to go forward? Right? Do I want to wait till it gets to 8? Like, if if I'm 4 plus 3 equals 7, now all of a sudden I'm like, oh, well, it's probably time. I'm like, that's a worse circumstance than I was in a few minutes ago. But it was like if then all the way through until I got to the point where I was like, oh, holy smokes, man, nah, I don't want to do that. Now, again, my selection was the radical prostatectomy. And I had to ask a bunch of questions about that because the incontinence and the erectile dysfunction and all of the stuff that goes along with your radical prostatectomy, that again was also stuff that was going to happen. There was no win-win situation in there, right? There was some stuff that I was going to have to deal with. It just was important to me to know which of those things I had to deal with and which one I was willing to live with in regards to my recovery and just my life after that. So I encourage you all that when you get in there and you are talking to your doctor, if, then the death. The backside of that, then what, is very, very important. Because do not let them just tell you you should do X, Y, and Z. Right? They're like, oh, well, you'll just have to change a pad in 2. And then what? Then what? Right? Then what? What if I'm changing a pad or 2, but or what if I'm changing more than a pad or 2? Right? What if it's 4 or 5 pads? Then what are you going to do? Hey, what if my erectile dysfunction lasts well past a year? Then what do I do? Like, what are your options in regards to that? Guys, listen, I am making these videos to get you actively involved in your care. Why? Because I'm just weird enough that is exactly what I do, and I found that my method has helped some people